So today's topic is fibromyalgia and Hashimoto's. We've done a lot on this over the years, and again, there's a lot of this on our powerhealthtalk.com site, and you can look up Hashimoto's and you can look up fibromyalgia and you can look up Hashimoto's and fibromyalgia. But it's interesting that this was the question of the week, so to speak, and it's kind of how it started. It's kind of like how this whole thing started. You're looking on Google, you're looking on the internet, and you're getting all of this stuff. It started back in the 90s with chronic fatigue immunodeficiency disease, and everybody who had that back in the 90s was considered a nut case. Like you need to go see the psychologist, and so it started out with that, with chronic pain, with the alternative healthcare guys going, no, they're not crazy. I can feel it. I can feel they're tender, they're sick, and so everybody was looking for the answer back then. And people were looking for, like, oh, it's heavy metals. Sometimes. Oh, it's all parasites. That's another whole topic, but sometimes. And on and on and on. There was all kinds of theories on it. Epstein-Barr virus. We now know Epstein-Barr virus is one of 39 different triggers. Okay, and so we went through that whole thing, and it was discovered at one point in time that by a couple of clinicians, that all of a sudden they started to realize that all of their it morphed in from chronic fatigue syndrome to fibromyalgia because of a lot of the pain, and then it morphed into calling it fibromyalgia. And then there were certain clinicians that started to realize that every fibromyalgia patient there was had some sort of abnormal thyroid problem. They were all on thyroid medication, and that the thyroid medication wasn't really helping because their thyroid numbers were still all over the place. Further investigation into that was when it was discovered that these were not hypothyroid patients. They all had Hashimoto's. And so there was an original understanding of that. There's a whole story to that in and of itself. But in the end, fast forward about 20 years now, and what we now know is when you get Hashimoto, and who's the fibromyalgia patient? Fibromyalgia patient, overweight, fatigued, tired, constipation, pain everywhere. Some people have pain in their torso. Some people have pain here. It comes, it goes. Some people have bilateral carpal tunnel syndrome. Some people have pain shooting down their arm and peripheral neuropathy. They've gotten it checked. Everything's normal. How could everything be normal? And it turns out that so much of this is related to Hashimoto's. Like I said, fast forward 20 years later, and we now know Hashimoto's is connected to, well, let's just start with the brain gut brain thing and the Hashimoto's gut thing. We know that Hashimoto's causes leaky gut now. We know that that breaks down the gut, and the next thing you know, you got things getting out of the gut. One of the things that can get out of the gut, there are many things that can get out of the gut, but one of the things that can get out of the gut is called a lipopolysaccharides. It gets out, it breaks down, its cell wall gets out. It's called an endotoxin, a toxin coming from your intestines. It can cause anything. It can cause Hashimoto's in a vicious cycle. It can cause inflammation. It can cause joint pain. It can cause autoimmunity in general. It can turn on almost any other autoimmune thing that you have. The Hashimoto's, the thyroid in and of itself can actually create inflammatory processes. It can create a cascade of inflammatory processes. It has the receptor sites in every single cell of your body. So I'm just going to run down for you. And I'm not going to hit them all because there's so many. I'm not going to hit them all because I'm not going to remember them all. Honestly, it's going to be like Hashimoto's can hit your cerebellum. Hashimoto's can talk to your cerebellum, and the next thing you know, you've got dizziness, vertigo, balance. You can have migraines. You can have blurred vision, stiff neck that won't go away. It can hit myelin antibodies, particular to the brain and to the cerebellum. But myelin antibodies, by the way, are the antibodies that cause MS, and they're starting to think that there might be a connection there. It can create an inflammation in your brain. It can decrease oxygen to your brain. And so that can cause brain inflammation, brain fog, and I can't think, and I'm depressed, and so on and so forth. Depression is, everybody comes in here who's got Hashimoto's is on some sort of antidepressant. It can cause anxiety when you get an attack on it. It can cause anxiety. It can cause panic attack. This is your fibromyalgia patient, is it not? It can, and so it causes leaky gut. It can stop you from fixing leaky gut. It has a relationship to your stomach, and if you get Hashimoto's and attack on your thyroid, you can get another attack on the parietal cells or in your stomach. Those are the cells that make the acid. Next thing you know, you got GERD, you got stomach problems, you got gut problems. What fibromyalgia patient comes in here doesn't have gut problems or constipation? That's thyroid. That can be a number of other things. It can cause that's autoimmune gastritis. It can cause autoimmune hepatitis. It can slow down everything so that your liver isn't really producing or processing fats correctly. So your lipids are up, everything's up, and then you're in here and they're giving you statin drugs because and the statin drugs are causing you to have muscle damage and pain and muscle pain. I've had a ton of fibromyalgia patients who've come in here. That was part of their fibromyalgia thing. So the bottom line is fibromyalgia was a term that they coined, and the term was incorrect. But at the time they thought it was pain in the muscle fibers, so that's what it means. Fibromyo means muscle, algia means pain, but it's not that. It's more neurological pain, but yet it's neurological pain caused by abnormalities in all of these systems. And so there are a number of things that you'll see in fibromyalgia, but we were just talking about it, the gentleman here behind the camera beforehand, and I had another colleague here, and we were talking about how many patients came in with fibromyalgia that had Hashimoto's, and he said like 80%. I honestly can't remember a patient who's ever come in here with fibromyalgia who did not have Hashimoto's. So it's somewhere between 80 and 100% of people who have fibromyalgia have Hashimoto's. It's a huge connection. I mean, and truly, for your edification, for those of you who are watching this, because a lot of people come in and they've been diagnosed with fibromyalgia, you might be picking this up. And what does that mean? Because I mean, today when I get people come in with a mystery disease, what does that mean? Mystery disease means they've been to 10 doctors, they've been to neurologists, they've been to the endocrinologist, they've been to the GP, they've had all their tests, everything is normal. The mystery disease, first thing I'm doing is looking for antibodies to the thyroid. Full disclosure, you got a mystery disease. I had one yesterday and it seemed like a pure neurological problem. By the time we stripped down this history, I'm like, we're running antibodies on you because I think you have Hashimoto's. And I don't look for it. It's just like, that's what shows up in here. People show up in here with these chronic conditions with normal testing, or now with testing that's not normal, but they're still not getting better. First thing I'm doing is running the antibodies on them to see if they have Hashimoto's. And if they come in here and they have all that stuff and they have Hashimoto's, that's going to be kind of the core of my attack to start with, because there can be multiple things with the chronic condition patients. But Hashimoto's and chronic conditions, in addition to fibromyalgia, is it's crazy. It is a big deal to look for it. And yes, if you have fibromyalgia, you have Hashimoto's. And if they told you don't, go find another doctor to check the antibodies. And if they tell you you're normal, go eat a big glob of pizza and then go take the antibodies. I'm telling you, the antibodies are going to come up that you have Hashimoto's. So that's my viewpoint on Hashimoto's from working with it now for God knows how many years. So, okay. So that's it for today. Hope you enjoy that. Any comments on that, which I suspect there might be, I'm open to hear them. All right, take care.